Well, hey, everybody. Good morning, good afternoon, and good evening. Wherever you are in the world, I am very, very honored to be here with Dr. Deb Mallu. And we are going to talk about some really cool therapies, everything from cancer to keeping your animal well. And her background is fascinating. You won't know it looking at her, but she has been in veterinary medicine 56 years. I mean, it's kind of like incredibly amazing. I'm fascinated by this lady. So welcome, Dr. Mallu. So we were just saying, I just said off camera, I said to you, is this a typo? 56 years? And, you know, are you comfortable saying your age?
Absolutely.
Yeah.
I'm 71 and I started working for veterinarians when I was 14 because I knew when I was 5 years old that I was going to be a vet.
You didn't strike me as somebody who cared to share it. So, I think it's something to be so proud of. I mean, you've got the wisdom of those years, and you've got the looks of somebody. I said you look younger than I do. I think that has a lot to do, and I mentioned this to you right before we hit record. This has a lot to do with your meditation, and you were a practicing Buddhist. 25 years, but you were a Buddhist nun for 21, yeah?
That's right.
Yeah, meditation will, boy, I'll tell you, meditation just gets you looking like that, folks. I do a little bit of TM, but I fall off the wagon all the time, boy. Transcendental meditation. So Dr. Mallu, so I want to start with one of the more unfortunately common issues with our pets, which is cancer treatments. A lot of people are doing a lot of the same things, but doing them a little differently. So it's always good to dive into this. And a lot of people are doing some very, very different things. And I think everybody needs to hear about this. So when they Google, when they're in a case with their own animal, these things can be pulled up, I hope, and accessed. So you said that you treat a decent amount of cancer patients, animals. Tell me, and let me say hi to Jack there, who's your little baby in your lap. Jack is, what is he, a Yorkie Poo?
3-year-old Yorkie Poo.
Yorkie Poo. He's as cute as you can imagine. He's got, is that a jacket I see he's got on? Yeah, so he's got,
it says, I love my mommy.
Oh, God. It's red and gray jacket if you're listening to this and not watching it. But he is full on, like, sprawled out in her lap. I mean, he is enjoying every second of this. So he's enjoying this podcast more than anyone, I think, can. All right. So let's talk about some cancer treatments and specifically what you're doing. Let's start with Ozone. Because I'm really interested in Ozone. I think it's amazing. I've used it a lot myself. How are you using Ozone in cancer therapy?
Well, we use what we call UVB Ozone, and that treatment is where we take a sample of blood from the patient, and then we mix it with ozonated saline, which is 3 oxygens, and then we also mix it with ozonated gas so that we treat the blood with oxygen because cancer doesn't survive in an oxygen environment.
Yeah.
Then we take that sample that's mixed with the ozone and pass it through UVB light 5 times. And the cancer is treated with UVB light because the cancer doesn't survive in that either. And then we give it back to the patient IV. And we do that with our cancer patients about once every 3 or 4 weeks. And it really does extend their life. In addition to the other things we do.
So I understand the oxygen part because cancer is anaerobic, right?
Right.
So which means it doesn't like oxygen, doesn't survive in oxygen. So you're giving oxygen. That makes complete sense to me. What doesn't make sense to me is the dynamic of the UVB. So you pass it through the blood 5 times. The light is exposed to the blood. What are you trying to do? Are you trying to have less cancer in the blood than before the transfusion and give the body a bit of a head start or a chance to fight it off?
Yes, and it's actually a small sample of blood For like a small dog, it would be 3 cc's. A medium dog, it would be 5 cc's, and a large dog would be 12 cc's. So it's not like a transfusion, but that little bit of blood actually goes through their system when you give it back and goes after the cancer cells in the body and treats it.
Okay, so this is making more sense. So, okay, so what do you have after you pass it through 5 times? Is it dead cancer cells?
Question?
Is when you passed it through the UVB 5 times, right? And obviously the oxygen, the ozone. I just want to focus on the UVB part. Is that like dead cancer cells that you're giving you're giving back to the animal in the injection? And
it's irradiated cancer cells, so that they're irradiated and they take the UVB into the blood to go after the cancer.
Oh, isn't that interesting? Wow.
And the same treatment is done very well with cats with kidney failure. And we've actually been able to have cats with kidney failure live for many years that have high creatinine levels. Like I had a 21-year-old cat with a creatinine of 5 to 6 that lived 3 years.
Wow. And why is that? So that's also the same exact process, 5 times UVB, the whole thing. Okay, why is that with the creatinine levels for kidney?
Works as a detox.
Wow.
Yeah, just detoxes the blood.
And what is it you're... So you don't have cancer cells in the kidney patient. What is it? What is getting zapped and going back in and detoxing?
Well, UVB goes after viruses, bacteria, toxins, and cancer cells.
Yep.
So you can use it for infectious disease, cancer, and kidney failure. We haven't seen results with kidney failure with dogs, but we have seen it with cats.
Wow. That's interesting. That's very interesting. Why do we think that is? Do you have any hypothesis for that?
No, I don't. Other than the oxygen, I think, just enlivens the blood so that the kidney is very well perfused. And when the kidneys are shutting down, they don't get perfused as well. And so the kidney, if I just can imagine it, thinking about how the kidney would brighten and then would do a better job of what it's doing.
But the difference between the dog-cat thing, you're not seeing it in dogs.
I don't know why I don't see a good result with dogs.
I mean, obviously they're different species, but they're different pH. You know, a cat is more acidic, which is super interesting, right?
Yeah.
I wonder if that has something to do with it. I don't know. I'm trying to think of what the heck could that be, but that's really fascinating. So with a kidney patient that's a cat, that's common enough problem. Is that something you do regularly? Like, would you, if you have a really severe case of cat with kidney, would you do it once a week, once a month, once a quarter?
We do it once a week for a month. Then we check the blood 2 weeks later. And then if it's either stable or improved, then we do it every 3 or 4 weeks.
Hey there, this is Rob Ryan. I just want to say how much we enjoy making this content for you here. And if you are enjoying it, would you like our video down below? And would you subscribe to our YouTube channel? It sure does help us get discovered by more people like you who need information like this. And also down below in our description, the top link is to our trial pack. We hope you'll order one for your dog so your dog can have fermented superfoods that give them nutrition like they can't find anywhere else. Hard to get nutrients that are easily absorbed. Thank you very much. Now back to the show.
Wow. Okay.
We also put them on supplemental kidney support supplements.
Yeah. Okay. Sure. Of course. And then if the UVB is detoxing, would you recommend this process as a wellness or regenerative treatment?
Some veterinarians do. We have not, just because most people choose not to spend the money for a wellness visit, but we have 1 or 2 patients a year that will do that.
Okay, so the financial component aside, is it highly advised? Like if I wanted to put my dog through a few treatments as a wellness regenerative medicine. Okay. Yeah. And I'm sure you see, I mean, it seems to me that what you would see is when an animal doesn't have a severe issue to deal with, like a cancer or, any other disease. It would seem to me, my gut tells me you would free the animal's system up to start regenerating and repairing other things. Is that fair?
Yes.
Okay. And that's always a good thing. My opinion. That's why I fast my dogs. It's give the body a day to do nothing but repair, and not have to keep up. So, I mean, the modalities you have incorporated into your life and your practice is like, kinesiology. I mean, it's an insanely awesome list here. I mean, this is a kind of vet that you want to go to, the kind of vet I want to go to. Kinesiology, glandular therapy, homeopathy, of course, nutrition, that should be at the top. Ozone, prolozone, laser, Western herbs, Chinese herbs. I'm getting to a point here. Chiropractic, energy healing, acupuncture. And then there's something here, I don't know what that is. IVAS, Thai Sophia.
Oh, that's just where I went to school.
Oh,
I'm certified in veterinary acupuncture through IVAS, International Veterinary Acupuncture Society. But then I went ahead and also did 3 years of a master's program and became certified in human acupuncture.
Okay, at Thai Sophia. Okay, gotcha. Great. So of all of that, and I'm sure I probably missed a few, but of all those modalities, I know they're all, they're different tools for different problems. But what are you most excited about in terms of the biggest hammer that you can use in the most things?
Wow, we do so much. Acupuncture and food therapy and UVB ozone. Right.
Wow, that's great. Okay, that's very interesting. So acupuncture, for people who've never bothered to experience it for themselves or their animal, can you just give us a really rudimentary, like, here's when you might want to use it, and here's what to expect in terms of time when you start seeing results? Because it's different. It's different than drugs. It's different than herbs. It's different than chiropractic. So how the layman person can see or be thinking about acupuncture therapy?
Well, the most common treatments for acupuncture are for musculoskeletal problems like intervertebral disc disease or hip dysplasia or arthritis, generalized arthritis or weakness in the rear. That's the most common. We also use acupuncture with our cancer therapy, and you can also use acupuncture with any other medical problems because Chinese acupuncture works with the theory behind Chinese medicine, which has to do with the balance between the elements, which would be your earth element, your wood element, your fire element, and your water element, which are related to all the organs in the system.
Yeah.
And then when you do acupuncture, most often we start out with 4 weekly treatments, and then we see a response generally within 1 or 2 treatments, and then we spread it out to 2 weeks, 3 weeks, 4 weeks, and then depending on what the issue is, they may come in once a month, they may come in every 5 or 6 or 8 weeks.
Okay. And again, that could also be a wellness tool if you have an older dog and keeps. How should somebody be thinking about like the chi and the energy circulation, the benefits of acupuncture for that?
Well, it's one thing where we very different than a conventional vet is when we do the annual exam, we actually check their pulses in their tongue and see what elements are weak. And then we can determine whether they need a Chinese herb to go home or whether they would benefit from acupuncture.
Yeah. Yeah. And even the taking of the pulse, that's a very different thing than a conventional doc. Yeah. Yeah. All right. So food therapy, you mentioned We've gone through acupuncture, top three, acupuncture and ozone, UVB, food therapy. So is that limited? Are you limiting that to mostly TCVM food therapy, or what's your philosophy on food therapy?
Much TCVM. I've done a very extensive course in food therapy with the Chi Institute down in Florida. But in addition to that, one thing we teach everyone when they come in for their first visit is the benefits of a good diet, even if it's not a food therapy session. And one thing we do teach people is to watch a movie called Pet Fooled on either Amazon Prime or YouTube, which describes when you high heat process dry food to make it dry, two carcinogens are formed. And most dry food is about 50 to 60% carbohydrate, which is all sugar. And those two carcinogens and the sugar feed cancer, so we recommend not feeding dry food or high heat processed dry food to dogs or cats.
Yeah. And
we give alternatives to that, which would be like air dried food, freeze dried food, fresh frozen raw food, and we also have an Instapot recipe that I've made up.
Okay, great. And you Pet Fooled on Amazon, and what was the other channel you mentioned?
YouTube.
Oh, YouTube. Okay. Pet.
And then when they have a medical condition, if we actually do a food therapy session with them, not only do we alter the diet based on what we just described, but we then look at the elements and see what elements are out of balance and whether they need cooling foods, hot foods, neutral foods, as far as the temperature, and whether we need to nourish the blood, nourish the chi, or clear dampness, or clear heat, all those sort of things. And then different foods have those qualities.
This is an area I've delved a little bit into for my dogs, but I pretty much just let my vet advise me. I didn't take a lot of time to understand it. I know about dampness and all that, but let's talk then and the heat and dispelling, all that. Let's talk about, can we categorize as simply as possible and generalize? We have to, obviously, what those, is the environment, the animal, let's call it, just focus on dogs right now. So if a certain dog, I'm trying to separate genetics from environment and circumstances, like what goes into to deciding, okay, this dog is damp, this dog is hot, needs to be cooled, and vice versa.
Some of it's the environment they're in, some of it's the diet they've been eating, and some of it's their own constitution, how they react to it because of their constitution.
And you don't bother figuring out that much why that is. Your TCVM.
We look at the imbalance and then treat the imbalance. So figuring out why it is, unless the diet that they've been on is one of the causes, then certainly we look at that as a cause.
Yeah. So maybe an example would be, you could theoretically have an overheated dog that is super healthy, but is like an Alaskan Malamute, but who should be in cold weather, but living in Death Valley or, Palm Springs, or the summers are really difficult.
And also you can have animals that have allergies that have a lot of heat condition because of the allergies from the inflammation. And then heat's involved. So that would be the cause, the allergy. Okay.
And then I'm just curious about the blood, treating the blood. What situation comes up? Give us an example or two of that.
Well, when blood becomes stagnant, that creates pain, and that can also create tumors. So a lot of tumors, you need to break the stagnation, move it, and some of the herbs we use are like stasis breaker to break up the stagnation of the blood. And you can also have anemia where you have a blood deficiency and you need to nourish the blood. So it can be just the opposite.
Oh, interesting. Dr. Billinghurst talks about eating bones and cartilage and connective tissue and all the stuff that, around bones because they're angiogenic, and angiogenesis is not feeding cancer cells the blood vessels to grow the cancer cells. Do you guys do anything in TCVM that has to do with bones? I'm just curious.
I haven't, but not personally now.
Yeah. Well, it's really interesting. So let's go back to some other therapies. So, what is your most, besides cancer, your next biggest? Well, I'm sure cancer isn't your biggest condition. I'm sure it's probably like arthritis or something. But what else do you see that you treat a lot and really successfully?
We treat a lot of allergies, and with the allergies, the one thing we look at for sure is food allergies and changing their diet. And then we also use Chinese herbs to clear the heat and clear what we call external wind, and that can help. Think what else? We treat a lot of IBD, intervertebral disc disease, and we have a lot of patients that come in that have come from the specialist, the neurologist. Chose not to have surgery, but they'll be totally paralyzed, and within anywhere from 3 to 6 treatments, they're walking.
Wow. And that's called what?
Intervertebral disc disease, IVDD, where the disc has popped into the spinal cord and caused paralysis.
Wow. Okay, wow. And is that, how common is that?
Very common.
Really?
Yeah.
And
dogs.
Smaller dogs, the longer dogs. So dachshunds.
Shizus,
Wow. Westies, huh? What is it you do for them?
We do acupuncture, and sometimes we add electroacupuncture to it.
Yeah.
And we put them on Chinese herb, hindquarter weakness, or cervical formula if it's in the neck, and CBD, and sometimes gabapentin. Depends on whether they're in pain.
Yeah, sure. You hit it with the hard stuff if you have to. Yeah. The CBD, there are so many that for people and for pets. How is it you sort through, if no matter what the brand name, it must be boom, boom, boom. What would be the top, factors for you whenever you look at a label?
The top factor is that it's a full spectrum endocannabinoid. That would be the top.
Okay.
And then I look at the dose on the label to see if the dose on the label suits my dosage.
Yep.
Because it's much easier for them to follow the label than for me to tell them to ignore the label and do this.
Right. And then do you care much about the extraction process, like CO2 or?
No.
Okay. And then do you care about its biodynamic or organic? No. Okay, cool. So you don't worry about hydroponic or in the soil or any of that stuff. Okay. You're very pragmatic about it. Just so broad spectrum and dosage.
Right.
Yeah.
Well,
yeah. Is there a synergy with a broad spectrum CBD and the Chinese herbs?
I think so.
Yeah.
Yeah.
There might even be something to get all of those in them a little bit better. That might be possible with CBD. All right, so
we also, back to the cancer, we also use a lot of medicinal mushrooms too.
Oh, amen.
Yeah.
And your favorites are the all-stars?
We use one called Mushroom Defense on the smaller dogs and cats, and then we use CAS options from, I think it's called Genesis, or they keep changing their name, who the manufacturer is, but CS options is a chewable tablet. A lot of people use turkey tail and immunity, but That's very expensive, and it's only one mushroom, and I prefer to use a mixture of mushrooms, the reishi, maitake, and turkey tail.
Yeah, I mean, if I was treating cancer and I have only a limited window of time to create results, I'd want to hit it several different ways. Yeah, I mean, why limit yourself? So, so let's go back to your favorites. So that one that you said is expensive, is that a brand that's expensive? A
lot of people that come to us have done research, and everyone on the internet says use turkey tail, so they get that particular brand. That Immunity, IMMUNITY. It's a very expensive turkey tail, and it's, you have sometimes 9 capsules twice a day, depending on the size of the dog.
Yeah.
The other thing that is important, or that we use for cancer therapy, is a product called Sun Solutions that used to be called neoplazine, that some vets know about, but not very many do know about. And that one goes after fast-growing cancer cells. It's an alkaloid herb, and it works really well with mast cell tumors and preventing further growth of mast cell tumors.
Wow. And that just repeat that again. That's called
Sun Solutions, that used to be called neoplazine.
It used to be called neoplazine. Okay. So the company is Sun Solutions.
The product is Sun Solutions. The company is Buck Mountain.
Oh, okay. That's great. Buck Mountain, Sun Solutions, Buck Mountain. Okay. We'll put these in the show notes too. And that's something, I see. I just Googled it. So Buck, BUCK Mountain Botanicals. Wait, awesome. Yeah, I mean, I think that if my dog was in the cancer zone, and you're going a more natural route, I mean, look, the conventional is just can be tens of thousands of dollars. Could be, I mean, at least you'd be easily in $10,000 range. I'm not sure I would be more interested in knowing what my dog would tolerate and giving them the maximum amount and going, just going for broke, making that this gets addressed. You don't want to be regressing when it comes to cancer.
Right.
Yeah.
Another good thing to say is when we've had cats that get intestinal adenocarcinoma, which is a mass in the intestines, Sun Solutions and Mushroom Defense, and some of them have lived with that tumor in their intestines for 3 or 4 years.
Wow.
Yeah.
And why is that?
It keeps it at bay, that it doesn't keep growing and doesn't block the intestine.
Wow. It just keeps, it's like most men that, like middle-aged men that get prostate cancer, they die with it, not from it. So it's kind of, sometimes in the cancer game, you can play that, it's basically just time, and you can extend life and not have to do anything really serious or put them under a very serious surgery. So many decisions to make, when you have an animal with a cancer. It's crazy. What do you know about, especially with cancer, like just throwing everything at it, things like hyperbaric oxygen?
There are people in our area that does the hyperbaric oxygen because we do the UV ozone. Most of our patients don't and do that in addition.
It just, or is it overkill, or you just don't? It's good.
Because once you figure out the cost of all the herbs and supplements and the UVB ozone, they don't go for the additional expense of the hyperbaric.
Yeah. Interesting. But would there be benefit with the UVB? It's different. But
there would be benefit.
It would be benefit. Yeah. Okay. So this is fascinating. I'm going to go down this whole rabbit hole of this Buck Mountain company, because it's the first time hearing of it. So thank you for that. All right. So now let's go into, I'm super duper curious about how you deal with another issue in your practice. So what's the next most common one?
Let's see here. We've talked about allergies, kidney failure.
IBD.
Yeah, IBD is very common. We do that a lot. We have a lot of diarrhea and IBD. And the first thing we do is food allergy testing and see what we can feed them and change their diet. And we put them on probiotics, which you would know about. And sometimes we actually do an animal biome test to see what their animal biome is and see what they actually need as far as supplementation with their biome. And we do have some Chinese herbs that we can use if we need to, depending on how bad their IBD is, whether it's on soft stools or liquid stools or mushy stools.
Yeah. Do you do traditional food allergy testing?
Mm-hmm.
Okay. So that's interesting. So is it always, I mean, not always, is it mostly food allergies, or is it
it's commonly food allergy related, but it can also be immune related, like an immune mediated.
Mm-hmm. Which could come from what?
If they weren't with us initially, it could be from over vaccinating, or poor diet that they've had prior to coming to us.
Could it be glyphosate? Anything like that? A chemical exposure? Yeah.
And that's the biggest cause of cancer these days, is the glyphosate, a toxicity in the world.
Yeah. It's ubiquitous. And, do you ever correlate where these dogs live? Like if they live on a golf course with all those green chemicals and everything to make a golf course look beautiful. And, the chemical drift that comes, but, you don't have to be on the golf course, but if you're close, and I'm just focusing on golf courses, but any communities where you've got beautiful grass, watch out. It comes at a price. It ain't free. And then we walk our dogs in these communities, and I let my dog walk where there are weeds growing. That's what I want, and not perfect green grass. Yeah, but because I just feel like it's like cancer. These allergies or reactions that seem like allergies, whether they are or not, they seem to be going up. And I just, I'm just wondering, what is it? Is it what's in the food, the common things that we're feeding our livestock that go into processed pet foods, or it's what's in our environment, or all these things? They're this horribly toxic cocktail that causes our dogs' systems to spin out of control and react wildly.
I think it's all of what you just said. And that's why we spend so much time when someone comes in the first visit about diet and what's a good diet to feed your dog or your cat.
Yeah.
And going over limited vaccines and using titers instead of vaccinating them every time they're due for a vaccine. We do an antibody titer to see if they even need the vaccine.
Yeah. And also, you've got these flea and tick various products that are combined, and you've got that too. And
And as far as that concerned, we look at risk of exposure first, and then we look at, depending on the risk of exposure, as to whether they can go with something natural for flea and tick, or whether they need to use something chemical. And then if we choose a chemical one, then we use one that has the lowest death rate.
Yeah. Well, that's just a truth. Yeah. And then with regards to what's the risk of exposure? What are you looking for?
Well, here's the thing. Like, look at Jack. Jack is a lab dog. I live in a townhouse, and so I have a very little grass in the backyard. And when I walk him outside, they're on a sidewalk all the time. So he has zero risk of exposure to fleas and ticks. So I don't use anything on him.
Okay.
And then if another client lives on a property that has a big backyard with a lot of deer in it, and they feel they have a higher risk of exposure, that would be considered a high risk of exposure.
Right, right.
And we also look at risk of exposure. Rabies is required by law, but if you want to look at risk of exposure for cats, if they're indoor cats, they're not exposed to rabid animals. They're not exposed to other cat diseases, so we don't vaccinate indoor cats.
Right.
And even the American Association of Feline Practitioners say the number one decision for vaccinating a cat is risk of exposure.
Sure. I mean, just makes sense. And then what about heartworm?
Heartworm, I too look at risk of exposure and determine it that way. With Jack and Bodie, my two dogs, they don't lounge outside for hours at a time. They just go for 3 walks a day. And in my neighborhood, I don't see mosquitoes. And because I don't see this exposure to mosquitoes, I don't put them on heartworm preventive, but I test them once a year. And if they have, then we offer 2 different types of heartworm preventive to our clients. One would be Interceptor, which is milbemycin, because HeartGuard, which is ivermectin, has been around for so many years that the heartworm has developed a resistance to ivermectin, and some dogs are turning positive on HeartGuard. Mm-hmm. And if someone wants to do completely natural heartworm preventive, then they can go to ambernaturals.com and look up HWF, which used to be called heartworm free, but the FDA got after them and told them they couldn't call it heartworm free anymore. So now it says it's a cardiac support that may protect against outside influences.
Oh, interesting. And it's just, I just looked it up. It's Amber Naturals with a Z at the end.
Yes.
Yeah. Okay. All right. Also very good. Another one I didn't know about. So, and that would be, for heartworm. And also heartworm, we should say that you're in the East Coast, right? You're in Maryland? Okay. Do you have a big heartworm, is that a hot spot?
It's a medium to hot spot, but if someone's in the South where it's a big hot spot, then it would be on heartworm.
Right. Yeah. And all the southern states are definitely so. And why do you only test once a year? Isn't the cycle of heartworm more condensed than that?
No, you only have to test once a year.
Oh, really? Okay, great. Well, I'll tell you, it pays to have a thinking veterinarian and how to paint by numbers, which can happen. This has been really great. And so, Dr. Mallu, what else can you tell us about your practice? And do you do any phone consults or anything like that, or Zoom?
A couple different things. One thing that I think is important to say is we're AHA certified, American Animal Hospital Association, which I think there's very few holistic clinics that are. And we do, because of that, we're integrated. We do all conventional treatments plus holistic treatments. So we do dentistry, surgical dentistries with panoramic dental x-ray machine and laser surgery instead of just a normal scalpel. And I generally don't do phone consults for long-distance patients because it's required by law to see your patient once a year. But sometimes I make that exception depending on the situation. So people can email us and tell us what the situation is, and then we can decide.
Okay, great. And for those of you listening, you can find Dr. Mallu at holisticveterinaryhealing.com.
Yes.
That's great. Well, Dr. Mallu, this has been really, for me, very educational. I'm going to be doing some research tonight on some of the things you said and really appreciate you bringing them forward for us.
Well, thank you, Rob. Really appreciate spending the time with you.
Yeah, me too. And Jack? Jack, hello. He leaves. Goodbye, Jack and Dr. Deb. Have a great day. Thanks for with us today.
Okay, thank you.
All right. Bye-bye, everybody.